We've never been tested before, but we're a strong nation, and that we would meet those tests. And that will be true again now with the situation we're facing in Victoria. This is a global pandemic. There are no guarantees in a global pandemic. You have to deal with the situations that are in front of you. You need to deal with them consistent with your strategy and your plan, and you need to bring the country together to focus every resource on fixing the problem and ensuring that we can keep Australians safe and that we can protect lives and we can protect livelihoods. This is the challenge we still face. There has not been a day of complacency when it has come to dealing with this challenge, I can assure you, on behalf of the Australian Government. And through the National Cabinet, we have worked together to address all of these challenges, and that will continue. For the people in particular of Melbourne, this is hard. This is a hard call on you. It's tough, and it will test you and it will strain. But you've done it once before, and you will be able to do it again because you've proven that. You've demonstrated your ability to deal with this. It's happening in Melbourne now. Of course, there's always the risk it could happen in other cities, and every step is being taken to seek to prevent that wherever possible. But we're all Melburnians now when it comes to the challenges we face. We're all Victorians now because we're all Australians, and that's where the challenge is right now. And so I want to thank all the premiers. Spoke to most of them yesterday, spoken to more of them today, for the great support they're giving to Victoria, whether it's in managing the very challenging issues now on the New South Wales-Victorian border, or the testing that is being done in Tasmania or in South Australia, indeed New South Wales and Queensland, the tracing work that is being done, drawing on the health professionals from Western Australia all the way to the East Coast. This is a national coordinated effort. And over the last several days, that has been where my focus has been, working with those premiers, working with the Chief Medical Officer, working with those on the ground as we are coordinating our response to support the efforts in Victoria. And so that's why there are 350 ADF people down there supporting the New South Wales effort on the border. That's why there are already around 200 ADF who are already supporting in the area of medical testing and other logistical support. That's why there is several hundred, in fact, the numbers of Commonwealth public servants up about 800, 900 supporting the door-to-door efforts. So it is a very significant Commonwealth effort to support what is happening in Victoria right now. And we will prevail, and we will get on top of it, and we will protect the rest of the country, because as I've engaged with other leaders around the world, they are facing the same challenges, whether in Europe or elsewhere. They are seeing, as they're opening up their economy again and fighting for the jobs of their own citizens, just as I am fighting for the jobs of our citizens, then they find there are outbreaks and there are cases. The one in Melbourne is particularly serious, but on an international scale, it is well within the band. And so it is not surprising, and that's why we need to continue to apply our focus and our effort and just work together as we did in March and in April and in May and in June, and so we will do it in July and August, September, October, November, December, and into next year if necessary. That is what we will do, and that's what we will continue to do. So I do reach out to those people, families, young kids, older residents, people working in essential occupations, and just reach out to them and say, the nation is with you, and we will be with you each and every day, because your success is our success. Our success depends on how well you're able to get through. And so whether it's the mental health support that needs to go in, whether it's the housing support that needs to be in place, these are the issues that over the last several days we have been dealing with to ensure that Victoria gets all the support they need. So with those remarks, I hope that addresses, as it should, the very significant issues we're now facing. And now I'd like to turn, if you indulge me, to the reason I've asked the Aged Care Minister to join me here today. And I think this is important because as we deal with the challenges of COVID-19 and the COVID-19 recession that is attendant to that and has created these two great crises Australia now deals with, the work of government continues. The needs out across the country are just as present as they were before. And one of the most significant areas of need that we have been addressing as a government since the 2018-19 budget in particular has been the challenges of in-home aged care. Now, it was only last year after the receipt of the interim report of the Aged Care Royal Commission that we immediately responded to the immediate request that there'd be additional places provided for in-home aged care, and we immediately moved to put an additional 10,000 places. Today, I'm announcing with the Minister an additional 6,100 in-home aged care places, which will bring to an additional 50,000 places at a cost of some $3 billion that we have announced since the 18-19 budget. And every opportunity we have had as a government to increase the number of in-home aged care places since the 18-19 budget, the mid-year update that followed, the budget that followed that, the mid-year update that followed that, and now where we are here today, where we had hoped to have a budget obviously earlier this year, but that won't be till October. We believe that was necessary to make this announcement now, and we will take every opportunity in the future, including the budget and the mid-year statement that follows, to continue to address this task. This is about ensuring that Australians as they age have greater choices, that families have greater choices. We have many challenges in this country at the moment, but we will see our economy strengthen. We will see Australians kept safe, whether it's from COVID or the many other threats that this nation faces. And we will guarantee the essential services that Australians rely on. And this is a very good example of that, in meeting the needs of our elderly and the in-home aged care places that they need, and there'll be more. And we will do that in a responsible budget management, which the Treasurer and the Finance Minister and I and other members of the Cabinet will continue to apply the discipline to, so we can meet all of those challenges. But with that, I'll ask Richard to make a few comments about the specifics, and then I'm happy to take your questions.
Thanks, PM. So the additional 6,100 packages is evenly split between levels 1, 2 and 3 packages. The rollout will commence immediately and as the Prime Minister has said, that takes our investment in home care packages to 50,000 since the 18-19 budget at an investment of over $3 billion. And as the Prime Minister has said, it continues our commitment to providing choice for senior Australians in their age as they age, but also the opportunity for them to stay safe, be at home and age at home if that's their choice. We're also announcing today that the Royal Commission reporting date will be extended to the 26th of February, so that's a 3.5-month extension to the Royal Commission. The Commission, having had to close down for about 3 months due to COVID, had requested an extension, and we're announcing an extension to the 26th of February, and Commissioner Pagone will become the chair instead of the acting chair of the Commission as a part of the announcement that we're making today with respect to the extension of the Commission.